My name is Petra Thaller. I'm the founder and president of Outdoor Against Cancer, and I'm really super happy you have joined us for today's first WellBeingHER webinar. Let's start with a short video called Two Minds, One Mission. It gives us a powerful insight into what drives our work and sets the tone of today's topic. Why physical activity and exercise is essential for cancer survivors. I'm very excited to introduce our today's speaker, Dr. Rūdolfs Cešeiko. Rūdolfs is the leading exercise physiologist specializing in oncology. He's also, like myself, a cancer survivor himself and co-creator of the 4x4 training. He will show us why physical activity, exercise, and sport are not just supportive, but essential components of cancer care and recovery. After the presentation, we will open the floor for your questions. And before we close, I will give you a quick outlook on what is coming next in the WellBeingHER project, in the webinar series, and you will also receive a follow-up with all the materials and the good information we will provide us today. So what I suggest, let's get started and enjoy the film.
Are we going to be the ones who looked away when we had the chance to transform cancer care?
Despite the recognition in ESMO guidelines, lifestyle changes like physical activity are rarely embedded in standard cancer treatment protocols. This gap undermines potential enhancements in patient health and treatment effectiveness. Studies have consistently shown that incorporating physical activity into the cancer care not only improves treatment outcomes, but significantly boosts quality of life. We no longer have to guess. We know that exercise is medicine.
Join us on this journey to redefine cancer treatment. Together we can ensure that no opportunity for enhancing patient care is overlooked. Let's make physical activity a standard part of cancer therapy.
This is our moment to lead, to learn, and to lend our voices for change. Don't shy away from transformation. Be part of a movement that changes the world for the better.
Thank you. Thank you very much for the applause. I have to be honest, I like the video myself. And Rūdolfs, we did a great job, right? So now the floor is yours. You are the specialist in that way. And I'm really keen to listen what you will present us today when it comes to physical activity and exercise as an essential part for cancer survivors. The floor is yours, Rūdolfs.
Yes, thank you very much. Welcome, everyone. It's a great honor to see you. It's a privilege and a great opportunity for me to share this presentation. And also, this is an invitation for you to be part of our story and the work we do, which is based from constant learning and searching and working with our patients daily. So we are committed in OAC to build the trust and our work and our thinking based on 4 pillars. And as you can see, the exercise and the physical activity is one of the key components. including balanced nutrition, sustainability, physical and mental well-being. And this is all about for the individuals who go through the cancer journey or beyond it. Next slide, please. So why WellBeingHER? What is special about this project? And as we know, the cancer, and especially the breast cancer, comes with the unique challenges, and therefore our mission is to provide a comprehensive platform, a comprehensive materials, not only in a written form or in a video form, but also in a very practical application form. So based on the data which are available to us and based on our experience, the main goal is to provide a comprehensive strategy that the person can use during the cancer journey. Yes, please. So, and why especially this project, and where, let's say, is the gap, where is the problem? And we know that there is a huge gap between the availability of the therapeutic approaches and including the exercise. And there are people that not always have access to these strategies. And even more, people do not actually have a possibility to use these things. So therefore, recognizing this huge gap between the literature available and a very well-defined and science evidence-supported information, we are this bridge that can help to create an easy, understandable, and very practical information. So these are the main reasons why we want to pay special attention to this project. And why breast cancer? So it's not a big surprise that the breast cancer is the most common cancer among women, and unfortunately these numbers are continue to rise. And as a researcher in an exercise oncology setting, that gives us some privilege to do the research, so that we can reflect and share the results. And the breast cancer patients typically are very motivated, and therefore we can use their support from the research aspect also. And women very often are motivated, and they can be a very good tool, very good strategy, and very appreciate the way we can appreciate the women's initiatives when they engage in health thinking. So therefore, having these things regarding the motivation and understanding also one of the good aspects. But we haven't forgot about the men also, although this project is mostly about the breast cancer patients and all the things we can provide. We have strong thinking, and we are thinking constantly about the project, for example, well-being him. So based on the communication and based on the results that we provide during this project, we can then scale and include men also, which is a critical mass that we need to think about it, and we haven't forgot about the men as well. So let's talk about important differences, and let's clear up the confusion. So this webinar is specially designed with more emphasis regarding the exercise, and you probably noticed that we rarely mention sport, although that is a significant part. But let's clear up some confusion. Very often doctors and the patients, they are in some confusion when we talk about physical activity, exercise, or active lifestyle, or even sport during the cancer treatment or beyond. And very often doctors or patients associate movement as a sport, but there are very large differences. The physical activity are general description of movement and activity when energy expenditure is increased. So those things can be day-to-day activities, light intensity walking, light intensity exercise, taking stairs, going for the shopping, or going out with the dog, which is good, which is necessary, and even that portion of physical activity has shown to be very effective. Although we think more and we like a more structured, more clear, more precise approach, which is the subcategory of exercise, and we call it exercise. And this is the one fundamental, the next step of physical activity. And exercise gives us a clear approach, a clear direction. We know what do we want to achieve, and therefore, for the patients and for me, when I was a patient, to have a clear understanding what do I want to achieve from the exercise gives me a clear direction and ease. So therefore, I can understand why the exercise is necessary. Exercise is structured, it's planned, it's voluntary, and we have a specific target. Mostly, we want to improve physical capacities. But there are also a third very important aspect of the physical activity, which is sport. We welcome sport, we like sport, we enjoy the sport, but there are specific rules, specific regulations, and very often competition is involved. When we talk about exercise or the physical activity in the terms of the cancer setting, we think more about exercise. This is the structured approach with the specific results we can get. So it's not a big surprise that the availability of the treatment is significantly increasing, but there are some side effects that we need to face, and many cancer patients face. One of the most important thing is the muscle and the muscle mass. So people significantly lose their maximal muscle strength and the muscle mass especially. So, and that leads to decline in aerobic endurance capacity. We feel more fatigue, we have less energy, our daily activities now require more from us. So it's basically more challenging for us to do our daily work. It can lead to osteoporosis, so our bones are getting weaker, they're more fragile. When we talk about the breast cancer surgery, and the post-surgery phase, it can increase, and it can be a potential risk for developing lymphedema. And typically people generally, unfortunately, do not engage in physical activities as much as we would like, or as much the World Health Organization suggests. People tend to be even more physically inactive. So the treatment helps, survival rates increases, but there are many side effects, unfortunately. Next slide, please. So, and here comes an invitation. Is an exercise a drug? And the answer is clear. Nowadays, with the support of evidence-based results from large amount of studies, we can say surely that exercise, prescribed exercise, is a drug, is a medication. And for various reasons, it is safe, it can help through the different stages of the cancer journey, and it can help us to manage fatigue, depression, it can improve our sleep quality. Of course, it can change all our quality of life. We can manage and control lymphedema. We can definitely, with the strength training, improve our bone density. And the most importantly, there are many interesting aspects that are working inside our body when we do prescribed exercise. So I'm very happy, for example, to see that kind of study supporting our strong belief and motivation and there are many, many more studies to come. So right now, that is not anything extra new, but we are very happy that science really supports that prescribed exercise is a medication. Yes? So, and I think you will definitely will like the next slide, because as we talk about exercise and prescription, and also this supports that exercise is a safe, and also the latest study that came out during the weekend that shaked up this scientific world a lot, that exercise is, let's say, one of rare medications that causes no side effects. So, and why not? And I think this is the near future when we have a prescription sheet and the doctor will give us a precise prescription of exercise. And for example, that can be different kind of intensities of cardio training or aerobic endurance training, including muscle strength training, or just simply staying physically active and enjoying the physical activities that you know that works for you. For example, Nordic walking can be a great addition to that. So stay close. Exercise is coming even more. So, and let's do exercise together. And this is one of our key statements in OAC, in organization, that the exercise is a lifestyle, and there are many variations of the exercise, because a lot of clinical trials, they are in some well-framed time period, for example, 8 to 12 weeks, and then the study is over. We think and we do exercise daily, and that is the part of our life, and we will continue today to do it forever. So, and here is the OAC certified training. If you're interested and if you want to find out more how exercise can help and learn the practical things, how to do the application regarding exercise in oncology, you are welcome. You can visit the site and you can finish the course. I have finished this course and it has helped me a lot. So let's continue. Exercise as medicine, cancer prevention and recovery. And for me as a scientist and exercise oncology, and also as a cancer patient, this gives me a huge motivation, and I'm very happy to see the title like this. So it also shows the magnitude that exercise has in cancer setting. Yes. So I think this is a key slide that opens up doors. The exercise is a part of cancer treatment, and all the leading organizations in the world support that, in America, Australia, and also in Europe, because, and the reason is well-established data. We have results, and I looked up yesterday, there are more than 34,000 clinical studies and approaching close to 4,000 randomized control trials. And yes, you're right. It's possible. Not always it is easy in a cancer setting, and there have been identified approximately 103 competencies that an exercise specialist should know when the exercise specialist want to implement evidence-based exercise in oncology setting. So these are well-established data that leading organizations in the world support. So what is special about the exercise? You know, it's yes, it's a movement. We do workouts, but it should not always be a workout. It can be walking to the workout, for example. There are many interesting things that exercise can bring to us. The most important thing, the risk reduction. If you are physically active, and especially when we talk about the woman in the context of WellBeingHER project. So the recommendation 3 to 5 days a week, so we can really see the reduction of the cancer development. I think for me that's amazing to see and to know. And if the person is diagnosed with a cancer, and if it is possible to maintain the muscle mass and also the muscle strength, the mortality risk reduces by 46%. So these are encouraging numbers. So I don't see any excuse why not to find appropriate way to exercise during the weekly routine. Although there is one problem. So, and the lack of motivation, or probably a lack of understanding or uncertainty what exactly to do, because physical activity itself, as you may know, it's a very broad concept. So what should I do? How many minutes? What kind of strength training should do? So, and therefore, unfortunately, a lot of people in the world generally, and the cancer patients especially, do not engage in sufficient amount in physical activities. So, and what are the dangers of physical inactivity? So, one of the leading risk factors and one of the most common side effects are loss of muscle mass, also known as cancer cachexia, when there's a significant decrease of muscle mass for the people that go through the training because of the treatment, because of the chemotherapy agents, and also increased amount of physical inactivity. People significantly lose the muscle strength, and it can be up to 4% every week when the chemotherapy is present. The bones are getting weaker, and many people don't regain the bone mineral density or the strength of the bones even many years once the treatment is complete. And the patients continue to lose muscle mass, which is fundamental, not only ensures our movement, but it plays a lot of vital role in our inner homeostasis and inner functions of our system. So the real danger is physical inactivity, and the cancer treatment do the side effects, of course, but very often they can get even worse because of physical inactivity. So what do we want to achieve? And from the exercise physiology perspective, to understand what should we prescribe as a specialists and how we should think about exercise program, we want to improve physical capacities. And as you can see, there are 5 essential components that determine physical capacity for every person. We can measure these capacities. And the number first and second, cardiorespiratory endurance, or our cardio. It's either walking, biking, running, and muscle strength. These are the main components of physical capacities. Therefore, it gives us a clear direction. When we want to think about the exercise strategy or exercise session, we definitely need to think one of these 2 essential components. So the main goal is physical capacities. And the next important goal, where the science is still exploring and trying to find new ways, and as I said, the exercise is something more than just the movement. There are many things happening into our system when we do physical activities. And now the exercise world in a cancer setting shifts toward molecular mechanisms. And we want to explore more what exercise really does in our system. And there are beautiful things happening. Muscles, they are secretory organ. During the exercise and at the specific intensity, and don't be afraid of the word intensity, because it plays a crucial role. Muscles release many proteins called myokines into our blood system. These myokines help to navigate immune cells, natural killer cells, more closer to the tumor. And also the muscle cells release into the bloodstream extracellular vesicles. And I had the privilege here in Latvia to participate in a one huge study when we saw a really promising results that breast cancer patients doing aerobic endurance activity 2 times per week significantly reduced the tumor size compared to those who do not exercise. So the idea behind that the movement and exercise is something more, and there are many biological things happening into our system. This is the main reason, again, together with physical capacities, why we do exercise. And for us and for you to navigate through the exercise and not always easy to understand what you do, based on our constant learning and our experience and from the clinical studies and working daily with the cancer patients, this is the result we have created. So this is the roadmap that you can easily use and follow, and the most importantly implement, and start to engage in regular physical activities. And there are many interesting points that you can follow and you can see, and these are the guidelines we have developed together with leading oncologists. They are relatively general, that's right, but when you go through these sections, and especially when you pay attention to those phases like the warm-up phase, the aerobic endurance phase, the strength training phase, now there you will see kind of the more specific, more targeted exercise approach, because these things play a very crucial role. In this document, you can also find what exercise do in our system, when you should exercise, but when you should actually stop and rest and continue another day. Therefore, these steps, these stages are clear roadmap for you to follow. They are safe, they are effective, and they can support your recovery or cancer journey. But as we like science, and not only on a paper, but more, we do it practically. For a couple of years, we've been developing and measuring and reflecting very good strategy. So it's called 4x4 training. And the 4x4 training consists of two main components. And the number one component is what you can see. This represents the heart rate. This is aerobic endurance training, and this is one of our signature approaches that we use in various settings. So also this training you can find in our roadmap. So this is kind of the more close look at this training. And the key factor in exercise oncology is the intensity. And of course, intensity is important, but there are some aspects that you should consider. So that typically this training is specific, and we use it based on the evidence that we have. This is a medical prescription. This is one of the fundamental approaches we do, because we can see and expect what kind of results we can get after the training session. And this training typically starts with 6 minutes warm-up. And when you go back to our training roadmap, you will find this idea of the 6-minute warm-up very often, because this is the time when you can see and measure how you feel. Because recovering from the cancer treatment or going through the cancer treatment, you probably not always feel very energetic. So how to know when you are ready for the exercise session? We suggest that you just try 6 minutes. And as the experience shows, in a 95% cases, person feels more better and continue the training. So in this case, in this scenario, we continue with 4-minute interval. So we walk a little bit faster. And the key aspect is to gradually increase the intensity, gradually increase your heart rate, so that at the end of the 4th minute, you feel slightly short of breath. But keep in mind that you can continue always the 5th minute. Then we have a 3-minute active break, and you can see the wave goes up again. We increase the intensity for another 4 minutes. And we repeat this 4 times. There comes the name 4x4 training. And we suggest to do such type of training 2 times per week. This is one of the fundamental aspects. I've been doing this training for 7 years, and it can change physiology very good. And most importantly, it can improve physical capacity and more specifically aerobic endurance performance. Let's continue next. And don't forget about the strength training. And before this slide and earlier in this presentation, I mentioned quite frequently the muscle strength and the muscle mass. And aerobic endurance training is good, but it mostly involves all body, all the system, all body is working. But the strength training is specifically that we want to aim, we want to think about our muscles. And there are several aspects that we can consider. And again, intensity plays a crucial role. And if we look on the column that's on the right, we often think and we want to integrate maximal strength training, and we have a very special and privileged experience to apply such training in breast cancer setting. And that kind of training may sound that we use a heavier weight, because comparing with the conventional strength training, when typically very light weight is used, which is very good, which is what we often do, and we welcome that type of training, but we try to progress relatively early, because we know the effects what heavier resistance can give. And just to clear, this is not heavy workout for 16 minutes, for example. There are certain episodes that we bring in higher intensity to stimulate the muscle fibers and nervous system even more. And regarding the strength training, using the 1 kilo dumbbells, not always we can think of it as a strength training. There's certain minimal adaptive threshold. And as you can see, based on the literature, this minimal adaptive threshold is relatively high, approximately 60 to 70% of your maximal physical capacities, or 1 repetition maximum. And in the next slide, there is a beautiful study that we did here in Latvia. We included breast cancer patients going through the treatment, and we did maximal strength training 2 times per week, and 1 training session lasted for 20 minutes. And the maximal muscle strength increased by 20% for a training group, and it significantly decreased for a control group. And what is important, we started this training 2 weeks post breast surgery, so very early, because the legs are working. In the legs we have a large muscle mass, so it's very smart to keep those muscles busy and active. And as you can see, even during the chemotherapy, we can increase the maximal muscle strength. Okay. And yes, that study lasted for 12 weeks, which is good in a supervised setting. But in a real life practical setting, we have a data, and we are constantly following these ladies. And we've been following them for 6 years, and very soon in autumn this year we will test them again, and we will have 7-year follow-up. And what is most importantly, that the maximal muscle strength, or kilograms they can lift 1 time, which is called 1 repetition maximum, it stays at a very top level even many years once they have completed their treatment. So this gives us a good rationale and good explanation and confidence in the work that we do. So even the many years post-treatment, the woman can keep the muscle strength at a very high level. So, as we are a very practical organization, we read articles, we do clinical studies, but most importantly, we complete this gap. We are the bridge between clinical studies and real life application, and therefore now there are two training groups in Riga and in Munich that we do weekly. I think the one training session is happening in Munich right now. Typically we unite approximately 20 to 50 people in each training session. And last weekend in Riga, we celebrated a significant milestone. It was our 100 exercise session. And these kind of activities really make a huge difference in our society. So, we will not stop here. We will continue to grow, and soon our 4x4 training will be in many, many European cities. And as this is WellBeingHER topic, and we recognize and we pay special attention to the time when we consider post-surgery time. Let's say it's 3 months. And then the engagement in physical activities can be different. So therefore, in order for you, or either you are a healthcare professional, patient, or the one who are interested in exercise, so there are 2 videos, and there are many more videos to come, that guide you through what you can expect based from the physical activity post-surgery phase. And actually we have created safe physical activity session that you can start to do 1 to 4 weeks post-surgery. So this is the time period which is very important. We want to pay attention to that, which is 3 months. After these 3 months, we can start to integrate more specific, more targeted physical activity approach. So go in our YouTube channel, find these videos, and start to implement them.
Thank you very much, Rūdolfs. So I hope you get a bunch of new information about what we are doing. I received some questions, and one of those I have to read it. How long do I need to train? I think the person, the lady, wants to know how many weeks, how many months does she has to train?
Yeah, the answer is relatively simple, and thank you for the question. And reflecting back to my experience and your experience, Petra, and this gives us the confidence, and our mission is to train for rest of our life. So the training is the part of our lifestyle. So, and you should not stress about the physical activity, but it should be consistent part of your weekly routine, every week for rest of our lives.
You could do it like your daily routine, like drinking a cup of coffee or tea or whatever, brushing your teeth, physical active. The next question is, what is more important, cardio, resistance training? So what is the answer?
These are very good questions. It may vary from the situation. For example, if we notice that the muscle mass is decreasing, and very often people going through the treatment or post-treatment can see that there is a reduced muscle mass in my arms or in my legs, then the focus should be more on a strength training. Let's see, if we take 100%, then we would want to focus on a strength training something around 70% of our time when we focus on exercise. But generally speaking, these both huge pillars, aerobic endurance training or the cardio training, and the strength training, these things are very, very important, and they are equally important.
Another question is guidelines versus listening to my body. What is more important, following the guidelines or the recommendations, or if you feel stronger, you can do more. If you feel weaker, you do less. What is
Yeah.
the way?
The general guidelines, they are safe. At some point, they are effective, but you understand your body, you know the way your body reacts, and engaging in physical activities, it's not a rocket science. So basically, when you do the physical activities and you have done it for 3 months, let's say, and you feel that these general exercise guidelines for you are very well tolerated, you can do some modifications and you can start to play around with intensities, with the timing, with the resistance you use. So the most important thing is to listen to your body, and surprise, surprise, the body knows the proper and correct answer to you.
So another question is if there is a training platform for breast cancer survivors. So can they go somewhere and get additional information?
Yeah, we recognize that people want to do exercise. They want to stay physically active because it helps so much. So therefore, we are creating very useful and very practical digital training platform that's going to be available. And following our homepage, you can find and you can engage in many materials and videos that we have already. So the many training platforms, comprehensive training platform, easy to follow, is under developing stage, and we will deliver this training platform very soon.
That sounds like a plan, Rudolf.
Yeah.
Where can breast cancer survivors learn more about the 4x4 training we are currently doing in Riga? You are doing in Riga, we are doing in Munich, and our colleagues in Spain from Alicante will also start very soon with the 4x4 training, and although other cities in Germany and perhaps in Latvia as well. So where can the people get more information about the upcoming trainings and what we are doing in terms of physical exercise?
As this is the first webinar in a WellBeingHER series, we will have upcoming webinars also where we dig deeper in a 4x4 training, what's especially we are doing, and what are the main nuances that you should consider doing the training, and how it goes together with different food applications, for example, during the treatment, post-treatment, post-surgery. So we will cover all those practical aspects that people can face. So you can stick to our schedule, and we welcome you in our next webinars. And of course, in Outdoor Against Cancer homepage, you can find and follow the 4x4 training there.
Okay, so we are almost there.
Petra, there is one question in the chat, if I may interrupt.
Yes.
Let me just read it out. First question, what about protein drinks? Some people are using them during chemo to not lose muscle mass.
Yeah, thank you for the question. And it should always see and measure if it is necessary. So if the muscle mass is significantly decreasing, and if the nutritional intake, the proper and well-balanced nutrition is somehow limited, and then with support with the doctor, nutrition drinks might be appropriate. But with a good exercise strategy, with a nutritional intake, the body should be well balanced to maintain the protein synthesis and therefore maintain the muscle mass. So it really depends on the situation.
And the second question, how does the patient know if during the therapy the exercise is not too exhausting or stressful for the body? Perhaps the body needs more rest.
Mm-hmm. And yeah, you're right. The energy balance is key. So, but what does it mean? Should we lay on the bed or not be physically active for 7 days? And therefore, in this exercise roadmap, we always encourage person to try for the 6 minutes. And if you kind of don't feel like doing the exercise today, but it's not laziness, but you feel the therapy is there and you're not feeling very good, just try for the 6 minutes light intensity walking. So we need to give a time a little bit for the body to reset, to increase the blood flow, and intensity should be very light. And then after those 6 minutes, you can evaluate, am I getting better? Okay, then I can continue, for example, another 20 minutes. Or I can, incorporate some part of 4x4 interval training. But if, however, you feel that your general feeling is not getting better, you say stop, you rest, and you try another day. This is the most effective approach how to really evaluate your general feelings. You should never push yourself through the exercise. And during the time, you will understand the correct feelings. Regarding the intensity, once the body is properly warmed up, body is ready for the higher intensity. And then you can gradually increase the intensity. For example, you do the walking, you can start to walk a little bit faster. So you can kind of feel that you start to breathe a little bit heavier more often, but you do not feel any discomfort. These things are very, very important.
Okay, no more questions in the chat.
Thank you very much, Michaela. Thank you, Rūdolfs. For me also, it's always really interesting to listen to you and to get more information about the topic of physical activity, cancer and cancer care and exercising. We will send out all the information material we provided in this webinar afterwards, and we will also send out a short questionnaire how you liked the webinar, because we are really on our way to getting better and better for all of you. So I'm really happy that you joined the meeting. Rūdolfs, once again, thank you very much for the presentation. Jill, thank you for sharing. Thank you to all of you that you joined our first WellBeingHER webinar, and I wish you a nice, good, and lovely evening. And bye-bye.
Thank you.
Bye-bye.